Good morning, everyone. My name is Rob Fredericks. I'm with the Housing Authority of the City of Santa Barbara, and I'm here with Dr. Lennon of the Santa Barbara County Public Health Department. And we're going to step you through on this video the Vulnerability Index Survey form for the 2013 Vulnerability Index Survey. And I will step you through each page along with Dr. Lennon, and it's a lengthy survey, but we've tried to pare it down to make it as simple and easy for you as an interviewer to administer the survey to people we come across, both on the streets and in the shelters and other places that we can find them. So the very first page here is a consent to be interviewed that we need to read to the people we find and ask them to be interviewed. And part of this consent form is, you'll note that we're asking, we're telling people that as part of their efforts in being a part of the survey, we're going to give them a $5 gift card. We're planning on $5 gift cards for McDonald's, so people can be compensated in some way for their time and for being bothered so early in the morning or during the time that we're giving the survey. So please make sure you go over that with the individual and family members that you come across at the outset. And it's very important as we come down to this form here that we have them bubble in that they agree that the information can be shared with the organizations listed, so that we can help them be housed and to be provided appropriate services, and then have them sign here and date and print the name of the participant below their signature. And also, if we have minors that are being interviewed as well, or taking their information, if there are multiple family members, we need to make sure that the parent or legal guardian sign here and date. Now, the actual survey form begins on the next page, and up here on the upper right hand corner of each page you'll have a survey number. That'll be pre-populated on each survey, so you won't need to worry about filling that in. Each area that is darkened in gray is point-in-time information that the Department of Housing and Urban Development needs for their point-in-time count. That's absolutely required by HUD, so we need to make sure that we do fill in that information appropriately. It's important that we fill in all the information appropriately, but we just want to point out that every area that's darkened gray is point-in-time information required by HUD. Everything else is information that we're gathering for our local efforts, so that we can do a better job of providing housing. So you see here, we ask them if the survey is being completed in a shelter, you would mark yes or no. Before that, the date of the survey, the location, please print neatly so we know the location of where the survey is being completed, and the first name of the person that we're interviewing, middle initial, last name, nickname. Often these folks have nicknames, so if you can get their nickname as well, and their birth date, phone number if they have one, contact number, social security number. And this information will be kept confidential, but it's important we have the social security number. Some agencies need that in order to access the information that they may have, like the Veterans Administration. Mailing address if they have that, city, state, zip, and also bubble in here if they're Spanish speaking only. Next we have the housing history information. This is all point-in-time information, again, that we need to find out, one, if they're currently homeless, where did you sleep on the night of January 21st, that night previous to the morning that we're doing the survey. We want to know where they slept, and also what is the total length of time you consider yourself homeless. If it's years, the number of years, plus months, or if it's just months, the number of months. And the most common location. It could be, you could say Lower Milpas Street or Upper State Street, La Cumbre area, something like that, that would give us where they're most commonly located. Also, the next question, have you been continuously living in a shelter or on the streets for the past year? That helps us determine if they are determined chronically homeless or not. And the next question as well, if they've, in the past 3 years, how many times have you been homeless and then housed again? If it is 4 or more times in the last 3 years, then they're also considered chronically homeless. The next question, if you're currently homeless, where are you staying or sleeping? And we want this information. This helps us quite a bit in determining where most people are, if they're on the streets and shelters, if they're doubled up or transitional housing. We also wanted to, go ahead, Dr. Lennon.
One of the very important items for determining homelessness is how long someone has been actually housed in a transitional shelter setting, or SRO is a single room occupancy, like if they're in a hotel, or if they're doubled up. So one of the very important questions, if they answer yes to any of those three, we need to know how many months they've been in that living situation. If they've been in that living situation more than 12 months, they're actually not considered homeless. So it's very crucial to enter the number of months they've been in a situation such as a single room occupancy, doubled up, or transitional.
Right. Great. And we also we asked this question last year, where did you live prior to becoming homeless? This helps us deal with the magnet theory that people are coming from all over the country to be in Santa Barbara. The last time we did the survey, over 50% were from Santa Barbara County, but we want to continue gathering that data to see if it still rings true. And also, if they are from the other areas outside of Santa Barbara County, what brought them here? Was it family, friends, jobs, services, climate, other? And then we also want them to what best describes why they became homeless. You know, that can be a very complex question. It's not many times not just one reason, but we thought we'd highlight kind of the bigger type answers that would cause homelessness and see if any of those ring true as well. And then now Dr. Lennon will take over and go through the health history, medical stuff on the survey. He's better equipped than I to take you through this. So you want to switch seats?
Sure.
Okay.
Well, thanks, Rob, and thank everyone out there for volunteering your time to obtain this information. The medical history portion of the survey is crucial to scoring the survey and identifying the most vulnerable of our neighbors experiencing homelessness in Santa Barbara County. So this information is very important, and be as accurate as you can in obtaining the information. Although the information is, for the most part, self-reported, we want to try to be as accurate as we can. So the first question is, what kind of health insurance do you have? Pretty self-explanatory. If they do have Medicaid and Medicare, you can bubble in both of those selections. VA actually is Veterans Health. Private insurance would be if they have like an HMO, Kaiser, or some other private insurance. And medically indigent adult is the county MIA program, which is not really an insurance, but if they say they have MIA or Healthcare for the Homeless program, just bubble in that, please. Where do you usually go for healthcare when you're not feeling well? Self-explanatory. Most people go to the hospital emergency room, or if they go to a clinic, or to the VA, or if they just say they don't go for care, just bubble in that selection. How many times have you been to the emergency room in the past 3 months? And just emphasize the past 3 months, and it's just simply a number answer. How many times have you been hospitalized as an inpatient in the past year? That means actually how many times you've been admitted to the hospital, not just been to the hospital, but actually in the hospital for more than one night. We want to find information about hospitalizations. We've listed the most common hospitals in the entire area, and what you need to do is just match the key to the visit So if they've had 3 hospitalizations, you'll put in hospitalization 1, for instance. If they went to Marion Medical Center, you bubble in E. And just simply the month and year. Now, try to at least get some information from that, because part of the scoring is based on timing. For instance, you already bubbled in how many times they've been hospitalized in the last year. We want to confirm that by trying to gather the accurate data as to the timing of that hospitalization. And remember, this is how many times they've been admitted to the hospital, not just been visited into the ER. So month and year, and then the reason, if they can give some sort of a reason, pneumonia, seizures, whatever the reason, and just try to print that accurately as you can. So go through and put in up to 3 hospitalizations. Some people may have many more than that, but we really only need to score them up to the last 3 over the last year, so just put in 3 visits. Same thing for the ER visits, just match the bubbles to the key, to what hospital they were at the ER, month and year, and reason for all 3 visits. The conditions, medical conditions, are also very crucial to the scoring. Again, we want to be as accurate as we can, because this is self-reported information. Many of the chronic illnesses will have medications that these folks will be taking. So sometimes it's a good way to ask the question is, are you taking medications for? Most of the individuals being surveyed will know their medical diagnosis is if you just simply read the chronic illness that's there, and you can just bubble in yes or no. Kidney disease, end-stage renal disease, or dialysis, most people will know if they're diagnosed with that chronic illness. The 2 weather type injuries, we want to confirm whether it was severe enough to be treated at a hospital or a clinic. So if you ask them about frostbite, hypothermia, or immersion foot, which is trench foot, or heat stroke or heat exhaustion, please bubble in whether or not they were treated at a hospital or a clinic. We don't want to be inaccurate by just someone saying they were cold when they were outside. It's pretty obvious it gets cold even in Santa Barbara County. But if they were treated at a hospital, then that's truly a history of hypothermia or heat stroke or heat exhaustion. Liver disease, cirrhosis, or end-stage liver disease, bubble in yes or no. Hypertension, high blood pressure, again, here it might be good to ask, are you taking medications for high blood pressure? Many people are taking medications for their blood pressure, but they don't think they have high blood pressure because the medications are controlling it. So you might want to ask, are you taking medications for? Perfect example also is for irregular heartbeat. Many people may not know their specific diagnosis, but they might be taking medications for an irregular heartbeat. Some of the specific diagnosis would be atrial fibrillation, ventricular tachycardia, so if they certainly know the specific diagnosis, that is good information to know that that's a confirmed diagnosis. Next, we want to find out about people that have coronary artery disease, so if they've had a heart attack, or heart surgery, or stents, or heart failure, those 3 things qualify as hypertensive or coronary artery disease, and we want to bubble in yes for that. Some of the questions we want to know specifically whether or not they're receiving treatment or they've been treated in the past. Certainly HIV, AIDS, not only is it crucial information to know whether or not they're receiving treatment, but this is also a point in time question, so please make sure that that one is bubbled in. Emphysema, COPD, chronic bronchitis, all those are similar diagnosis, and those would be simple questions to ask. Most of the time people know those specific diagnoses. Diabetes also doesn't matter what type, whether it's 1 or 2, or if they don't know the type, if they're diabetic, we just want to know, yes, they are diabetic. Asthma is a little different than COPD, emphysema, that's why we have it as a separate entry, but most people would know if they're diagnosed with asthma. Cancer, we simply want to know whether they have been diagnosed with cancer currently or in the past. Hepatitis B and C, again, that's another one that we want to know whether or not they're currently receiving treatment or they've been treated in the past. Same thing for tuberculosis. Please make sure you bubble in whether or not they've had past or current treatment. Obesity, you can ask the question. Most people won't know specifically if they're diagnosed with obesity, but just do the best that you can with that's kind of a vague question, but just do the best you can. Stroke, if someone has had a stroke in the past, it doesn't matter what type of stroke, just bubble in for us whether or not they respond to that question. Traumatic brain injury, we're finding a lot of folks experiencing homelessness that suffer, unfortunately, from assaults or falls. And so a traumatic brain injury would be any type of head injury. So if they said they've been treated in the emergency room or the hospital for a head injury, that would be a traumatic brain injury. Seizure disorder, if they say they have epilepsy, that's the older term for seizure disorder, so just bubble that in. Chronic pain, we're trying to identify possibly those that have chronic pain syndrome and also alcohol or drug abuse to determine whether or not there's a link between those two. So most of the time those people are taking some sort of medication for some area of the body that they're experiencing chronic pain. Tobacco use, whether or not they smoke. And then any other conditions that they offer, that they have a medical condition that was not discussed or bubbled in, then just write it in as neatly as you can and bubble in yes for us. The next portion is on drugs or alcohol. Simple question, have you ever abused drugs or alcohol or been told you do so? Just bubble in yes or no. And then select all that apply. We want to try to separate out those that are having drug and alcohol problems or just drugs or alcohol. So please bubble in both if they say they've had both problems or just one or the other. These next three questions also are based more on scoring. Have you consumed alcohol every day for a month? Have you used injection drugs or shots? Have you ever been treated for drug or alcohol abuse? And then this year, new to the surveys, we're asking what the treatment location is. So if they have gone into detox or been treated for alcohol or drug abuse, please neatly print the treatment location. These next questions about domestic violence are point-in-time questions, and we want to try to capture as accurately as we can whether anyone has been a victim of domestic violence. Are you currently or have you ever received treatment for mental health issues? And then whether or not they know the diagnosis, what type of mental illness they've been diagnosed with. These three here are the serious mental illnesses: schizophrenia, schizoaffective disorder, bipolar, or post-traumatic stress disorder, PTSD. Other mental illnesses: anxiety, obsessive compulsive disorder, OCD, depression, or other. If someone says they have a personality disorder or something that's not listed, just print it neatly in that box provided. Have you been taken to the hospital against your will for mental health reasons? These would be people that would be actually hospitalized without their consent, and that would be just a simple yes or no. We're also trying to capture information about where these folks are trying to access health care. So we want to try to put in at least the last 3 clinic visits, whether it's medical or mental health. And here we just want you to simply write in as accurately as you can where they access health care. If it's public health department, try to put in what clinic they go to, whether it's Santa Maria, Carpinteria, Santa Barbara. If it's any of the mental health clinics, same thing. If they go to mental health in Lompoc or Santa Barbara, just simply put in mental health Lompoc. CARES, Veterans Administration, If it's a private doctor's office, that's fine. Just write in whatever they list as their healthcare provider. Again, just month and year. And the reason here would be if they say they go for their chronic care, that would be routine. If they go for an acute problem such as a cold or a cut or laceration, then you can put it's an acute visit. If they don't really know, then you can bubble in other, or simply leave those bubbles blank. Here we're trying to capture a little bit more information about just whether someone has had an attack or been a victim of violence. So just bubble in yes or no. And we also want to capture whether or not this was actually reported to the authorities. We're finding a lot of the homeless residents are not reporting to the authorities, and we're trying to determine exactly how much violence there is actually out there going unreported. If you could try to type in what type of violence it is, whether it's domestic, whether it was child abuse, whether or not it was just an assault, just simply print neatly whatever is described. Again, point in time information. Do you have a permanent developmental or physical disability? Again, this is whether or not people are in wheelchairs, if they're obvious amputees, if they're using crutches, if they're using a cane, if they're using a walker, anything that limits mobility. Have you had a serious brain injury or head trauma that required hospitalization or surgery? This is again trying to capture whether someone didn't realize they had a traumatic brain injury or not. This is a little more specific information as to that type of an injury. Last question from the medical portion of the survey. Are you taking prescription medications? We just simply want to know whether or not they're taking the medications, yes or no. Are they taking them as prescribed, yes or no? And do you know the names of the prescription medications? We don't really need to know the exact names. If they want to offer the names, if they know the names, that's wonderful. You don't necessarily have to write them down. We simply want to know how many people are taking medications as prescribed and if they actually know the names of their medications. So I'll give it back over to Rob now to go through the remainder of the survey. Again, thank you all so very much for volunteering your time to help us obtain this information, which is so crucial to providing services and housing those that are most vulnerable experiencing homelessness in Santa Barbara County.
Great. Thank you, Dr. Lennon. Okay, moving on with the survey now, continuing with other demographic information. We want to know, this section covers military, criminal, and other demographics. So first off, we want to ask if they've ever served in active duty in the U.S. military. It's a yes or no. And then what branch of the U.S. military, if they can give us that. We also want to know if they've served in a war or war era, and which era that would have been. Hopefully we've covered all the eras that people would have served in, and there's also an other if none of the above apply. We also want to know the character of their discharge from the military, whether it was honorable, other than honorable, bad conduct, dishonorable, if they're willing to give that information. Also jail, we want to know if we've asked these questions last year, we're repeating it again this year. It's very important information if they've ever been in jail or if they've ever been in prison. We also want to know if they've ever been in foster care. And the next question, have you ever had an open case with Child Welfare Services? If they're an adult, that helps us know if there are other children involved or have been involved. So that helps us with that. We also want to know their sources of income, if any, and we have a variety of information. You can fill out more than one here. We want to know all sources of income. So people could be on SSI and other income or general relief or any one of these, even panhandling. We want to know about. We just want to get a good picture of the sources of income. And if they can tell us what their total monthly income, that's important for us to know as well when we're trying to house folks, that what they can afford and not afford, what kind of subsidy is needed, rental subsidy. Again, point in time information for HUD, they want to know the gender of the person we're surveying, so whether it's male, female, or transgender. And we also want to ask race information and ethnicity, so we have the HUD defined race categories as well as ethnicity, whether Hispanic or non-Hispanic. It's also important for us to gather information on their level of education. So we have all the different levels of education. If they're a college graduate, that's all you have to put there, and if hopefully we can get that information. We also want to know, if they decline to answer or other, if they can read and write. Literacy services would be important for us to be able to institute, so we want to know how many need help with that. And closest living relative with their phone number. That really has proved beneficial this last couple of years from the previous vulnerability index. When we need to contact somebody, if we can't contact them, if we have a closest living relative with a phone number, that helps, and what their relation is to the person. We also want to know the outreach worker's name, if there's an outreach worker, and their agency. If a person is working with somebody at County Alcohol, Drug, and Mental Health Services or one of the nonprofit service providers, who that person is and what agency. That helps us also to remain in contact with the person. We also want to know family household information, and this is point in time information again. So we want to know if any other person younger than 18 years of age live with you on the streets, yes or no, and the number of people younger than 18 years of age. And we want to know other persons 18 to 24 years of age living with you on the streets, and the number there. And any other person older than 24 years of age living with you. That helps us determine the household composition, so it's real important that we get that information. And then we have you sign your name as an interviewer, your first name and your last name, and the team number that you're on. And we'll assign team numbers during the training days. Next on the survey, last year we had a completely separate family survey to gain even more information on the composition of the household members, and we've decided to combine it all into one survey. Hopefully that makes it simpler for everyone. So if there's a household that we're surveying, you'd continue on with the survey on this page, and on here we're asking if there's another adult family member in your family household being surveyed, yes or no, and what their survey number is, so we can cross-link. Then we also ask, we want to know the gender and age of the minor household members. So, if there's a female child that's 1 year of age, put that in. If there's, hopefully we have enough boxes here to fill out the total number of family members. And we want to know if any child living with the family has a serious chronic medical or mental condition as well, and that's a yes or no. And do you have any children that are not living with you, yes or no? If yes, where are they living? If yes to that question, where are they living? Just write it in here, or circle in here down below. And if it's an other, then you would write it in. Next question, are you currently working on reunification with any of the children that are not living in your household? We want that information. That's important to us. And are you or your children currently receiving services as a result of an abuse or neglect investigation? That helps us as well, help to reunify the family, having that information. And are you currently pregnant? Yes or no. And did you ever experience any physical or sexual abuse as a child? It's real important for us to have that information just to be able to help the individuals and family members. If you have other notes that you want to make on the survey, this is the appropriate area, not in the margins, not up above. Here on this very last page, the notes section, you can put in annotations that you want here. one important thing to remember on the survey is these are self-reported responses by the individuals. We're not observing and saying, oh yes, this person has diabetes. We can't do that. All of these questions are self-reported. That's why we're asking the questions to them and they're reporting it. So just so you're aware of that. And again, on this family information to sign here, put your interviewer first name and last name and team number. So that's it. That is the survey in total. I really appreciate you hanging in there and listening to the entire survey instructions. We hope we've made it as straightforward as possible. And again, I thank you as well for being a volunteer, taking the time to help us out with this important issue. It's time for us to stop managing homelessness and ending homelessness. We need to end homelessness, not manage it. So thank you, and good luck to all of us this year. Thanks.
Great.
All right.
Good job. I think it came out well.
Yeah. So I'll do the post-editing and put it all
Okay.
together, and I'll send it out to you. And
Very good.
look at it. Thank you.
Thank you, Rob.
Yeah.
Appreciate it.
All right.
Get out of here so you can do some real work now. And that's the truth.
Yeah.
Put your work on the back burner.
Yeah.